They were talking about pinching lower back pain. I'm Amanda Armagost.
And I'm Dr. Abbasi for Essence. And I know a lot about the spine, but pinching lower back pain, that's the first time I hear that. Tell me,
This
what
is
is
actually a problem I have personally had. I don't have this problem right now. But when I was in school, I used to sit with my legs crossed a lot and do this while doing my homework.
Mm-hmm.
And I noticed when I would sit like this for too long, eventually I would say like my very, very low back would have a pinching feeling.
Okay.
And
Describe it to me, that feeling. Because I think I know what you're talking about, but I want to truly understand it.
yeah. So it would feel like maybe like the best way I can describe it is maybe there's not enough space in my low back and that things are getting compressed. That's the way it feels. And
tell me what you feel, not what the mechanism is.
yeah, I
what you
feel pinching. Like
I feel like a sharp pain.
I feel like this, like pinching. It's not pinching with the nails, but it's like a tightness, like
Is it superficial? Is it deep?
underneath.
You feel it deep.
Yeah.
In the middle of the back, to the side of the back? Where exactly?
Yeah, I would say like to the
Show me.
side.
Stand up and put your thumb on where you feel that.
Maybe like right here.
Okay.
So I would have it here or here,
Yeah?
depending. But I did find, and this was years ago, I don't have this pain. Sometimes I do get this pain. But I've found that if I do like, people might not want to do this, but if I do like 50 squats 2 days in a row, then the pain actually does go away.
Okay. Where you just put your finger on, can you do it one more time? Okay. Now, this is actually a test. We ask the patient, and I always ask my patient, put your thumb on it, because then they put the whole hand and so on. And they say, no, put your thumb on. If you twice point to the same point, and that is within vicinity of the sacroiliac joint, we call it Fortin test. FORTIN is the name of a person, a doctor. So this is a typical symptom of the sacroiliac joint problem.
Yeah.
Now, but this pinching, and obviously that's exactly where the sacroiliac joint is, and especially what you just simulate that posture one more time. And that has exactly what we call the motion of the twisting of the pelvis that provoke the sacroiliac joint. Okay? Now, but there are lots of other problems or symptoms that are similar to that if the same feeling is a little more to the midline or is higher, that could be on the back of the spine. Now, spine is made of bone, disc, bone, and in the front, there is a disc. In the back, there are two joints, one on each side that connect two bones to each other. Those joints, they don't have much motion, but they do have some good amount of motion, and there is what we call a capsule around that joint, facet. We call that facet. Now, sacroiliac joint as well, we call it a joint, is not a real joint. It moves very little and so on. But
Chameleon joint.
Because it can pretend to be causing problem that can pretend to be other problems and so on. But facets are as well, has a little more motion, but it's still not a real joint. And then you can have exactly the same feeling higher up, more in the middle. And that we have other names for that. We call that, like in German, you used to call it lumbago, but that's a term that not often, I haven't heard it often here in the United States.
Okay.
But more or less, a joint has a certain amount of natural motion. Like we know that motion for sacroiliac joint is about 4 degrees, like opening it up.
What about, sorry, but I'm hypermobile. We've talked about this before.
Yes, we did.
If you're hypermobile, does that mean your sacroiliac joint might be hypermobile too?
Yes, absolutely. And that makes you more likely to have joint-related, because every joint is surrounded by what we call a capsule. This is a tough membranous tissue, and they're very well innervated. And their job is, if you stretch them too much, literally, they tell you too much, stop, so you don't damage the joint. Now, it just happens to be that, certain joints like facet and sacroiliac joint don't have too much motion to start with, but when you stretch them, all of a sudden they send you the signal pinching that enough. What you're doing is not good, and then you just said you go squat, you do something else, and bring it back to the natural motion. Now there is another thing. Imagine, put your hands like that here. Imagine this is the joint, and my hand is the facet capsule. Imagine this facet capsule is loose for whatever reason, and all of a sudden you turn it so far that when it's come back, it folded inside and pinch that facet. Then all of a sudden people have this horrible, the most horrible pain that literally come from that facet joint is actually pinching the facet capsule, which is extremely pain sensitive. And that is what we call lumbago. Okay.
And is that always, can you tell me again where that is? When someone has lumbago, where would they feel that?
In the lower back, but in the lower back, we have 5 lumbar vertebrae, 1 sacral, and then thoracic and so on. Each of them, between 2 of each of them, there is a facet on the left and the right. And that happens now literally when you do some motion, all of a sudden you stretch them more than normal, but when they come back together, it pinches actually that capsule. And that's why we say if you have it right now, right there, the best thing is actually to do what you just did that provoked that, because then you're hoping that bring your hands together. Imagine, this is normally this, but all of a sudden you stretch them so far when they fold back, it goes in, but if you fold them back, next time hopefully it comes out again.
Okay, so.
But if you wait, even you wait like half an hour or 10 minutes, sometimes 15 minutes, then there's some inflammatory material that it prevented to.
So you do exactly what you did to hurt it on the same side that you did.
Right then.
Like, okay, for example, if I'm sitting like this and I hurt myself, I do it again. I don't do it on this side.
No, same thing.
Side.
Same thing you did to recreate that motion of the joint to get that capsule out of it. Okay. But you have to do it right away. It's painful, but if you do it right away, you may not need to see a doctor.
Okay. So at what point when you do have sacroiliac joint disease, or like me, I'm having this pinching, I'm not right now, but I was having this pinching in my back. At what point should you go to a doctor, or instead should you be going to like a chiropractor or yoga or something like that?
Well, generally, pain is always a signal that something's not right there. And there is not a one rule that applies to all. But number one, if the pain is generally below 5, we call it the pain that can be managed with other things. But if the pain is above 5, you need to see a professional. Okay, depending on what the situation is. And it doesn't matter what part of your body. If the pain that's above 5, that means something is really wrong that needs to be looked at. So my recommendation there is, if in question, see a professional. That's the best recommendation I have.
What if you are having pain in that area? Mm-hmm. You go see a professional. They give you they do some imaging, and they say your back looks fine, and it's actually your sacroiliac joint. Mm-hmm. What are some things that you can know to continue this treatment, or continue searching into your treatment? Is it my sacroiliac joint? Well, because actually a lot of people don't know this as patients, but not a lot of people even treat the sacroiliac joint.
They're not trained. They're not trained. Lots of doctors are not trained to treat them.
They don't even actually believe in sacroiliac joint disease yet, because sacroiliac joint disease is kind of like starting to become more popular and more research.
This is the most neglected entity, actually, musculoskeletal. There are a good amount of studies out there that if you have 100 people with lower back pain, 22% of them is not the lower back, it's the sacroiliac joint. But if you had previous surgery and now you have back pain, that number jumps up to 43%, actually. That 43% of the people, you have 100 people who had back surgeries, fusion, especially fusion. Now, these are people had back surgery now coming back for spine problem or lower back pain. 43%, almost half of them, the problem is not spine anymore, it's a sacroiliac joint. These are validated studies and so on. So this is the vastly neglected entity of sacroiliac joint.
And it's usually like women who are in their 30s who have had a child, who are
Younger-
runners, right?
So the average age, for having spine problems, obviously when you get older, is above 50 to 70. But the average age for sacroiliac joint problem is younger, women more, because the only time the sacroiliac joint moves is when a woman is giving birth to a baby. And then as well, it's actually, biology is amazing. When a woman get closer to the delivery, there's some enzyme, they come and loosen those ligaments in our pelvis. So baby doesn't have to struggle to get out or struggle less to get out. But guess what? Those are loosening the ligament. So and that's a place that the sacroiliac joint has to really open up. But for a few years, you're 7 times more likely to have sacroiliac joint problem after the delivery.
And runners too, right?
And yes, younger, female, after the birth, people who are runners or do sport as a general, minor activities, especially many of these people say in the night when they turn from side to side. Now, if you don't know, just take a video of yourself when you're sleeping. Every 20 minutes, you're automatically changing the position. Otherwise, you will have zores. And those are big deal. People who cannot do that, they get sore in no time. I'm talking about breakage in their skin. But in the night, people with the sacroiliac joint, every time they turn from side to side,
They wake up.
twisting of the pelvis causes sacroiliac joint pain, they wake up. For that reason, they think, in the night, they think that the pain is much worse in the night. Whereas it just wakes them up because it's painful.
So is sitting with your legs crossed the problem, or is sitting with your legs crossed also slouching to a side the problem?
Well, crossing the leg is actually one of the exams we do to provoke the sacroiliac joint. See, when somebody comes to us with a sacroiliac joint, we get the history.
No, I
and
mean
the exam.
crossing your legs, not like this. I mean like
Anyway you cross your leg, you are putting more stress on the sacroiliac joint.
So is it bad for you to sit with your
It
legs
is
crossed?
not bad. It just put more stress on the sacroiliac joint because it puts stress on the pelvis. Now, I'm not using stress here as a negative term. I'm
I
just
know.
saying that it is more every time you go for a run, you're stressing your body, but that's a good stress. So generally crossing the legs put more energy or force on the sacroiliac joint.
Did you want to say something?
And that is sometimes what we use to actually diagnose it, by doing those motions, crossing the leg and putting pressure on the sacroiliac joint to see if that is the problem or not.
Okay. So if you think that you have sacroiliac joint pain, you went to the doctor, they looked at your low back, nothing's wrong. How do you advocate for yourself? What are some things, like some
Go
ways
to a
that
doctor who treats both spine and the sacroiliac joint. See, if you bring an airplane to a car mechanic, he's just going to say nothing wrong with this car.
Mhm.
But if you bring it to an airplane mechanic, then he can repair it. If you bring a car who has electrical problem to somebody who just does the carburetors, he says nothing wrong with the carburetor. But if you bring the car to somebody who fixes carburetors and the cooling system, then it's more likely that find what the actual problem is. So if your doctor is not trained in the sacroiliac joint and doesn't treat that, there are very few doctors who say, it is outside of my expertise. Go to somebody who treats sacroiliac joint because it could be sacroiliac joint. No, there are 9 out of 10 times they are going to tell you, there's nothing wrong with you. Just get out of here.
Yeah, go to physical therapy.
Yeah, at best, yeah.
Yeah, but at least just do a little bit more research. Try and find someone who does treat sacroiliac joint pain. Are there any ways that someone can strengthen their sacroiliac joint so then they don't have SIJ pain?
Like any other muscle area in our body, our skeleton, our bones are move They don't move by themselves. We need the muscle to move them, to control them, but as well, the strength of any joint and muscle, you can increase that within a limit, within limits. Obviously, you can as well overdo it, but within limit, if you have a healthy lifestyle, a moderate amount of exercises, and so on, you're strengthening the muscle around the bone, any joint. You're strengthening the tendon that attach to those bones. You're strengthening the capsule and the integrity of the joint. Now, our problem is that we go, and let me be very clear. Some of you may hate me for that saying, especially a few of people in my own family, my children. Your body is not to run marathon. Your body is made to walk a marathon anytime, but it's not made to run marathon. How do we know that? People who do that high athletic for living, their joints are 20 years older than they are. All their joints.
Their knees are always in pain.
And
also, sorry, but also, we aren't meant to be running on concrete anyway. We're meant to be running on earth, and the concrete is
short distance. You are meant to run short distance.
But think about it. When you have this concrete, it's so hard. It's a lot more of a shock to your joints than if you're running on the grass or on the sand.
Your joint. Yeah, absolutely. No, walking is human specialty.
Yeah.
No animal, no living thing in the whole known universe that we know of can be as efficient by walking as human. Our body is made for it. Walking is good. So walking 40 miles, I think that's something that our predecessors probably, maybe not 40 miles, but 40 kilometers, not 23 miles, something that they used to do. But running 40 miles is definitely not what our body is made of. Now, having said that, too much of anything is bad, like too much of water will drown you. That nothing more vital than water. But a good amount of exercise to keeping the muscle active and strong around our spine, it controls the motion in a good way. It has its own auto-regulation, and it keep it out of trouble.
Thank you guys for watching. This was Essence of Medicine, and we talked about low back pain. I'm Amanda Armagost.
And I'm Dr. Abbasi for Essence. And next time you go to a doctor who doesn't listen to you, just look for another doctor. That's a fair thing to say.
Definitely. And even then, maybe you should be looking for multiple doctors. It's always good to have multiple opinions.
I would always agree with that. Thank you.
Have a safe weekend.
That was good.
Yeah, but they were both good, right?
Yeah, that was good.